It's World Hepatitis Day, and while Canada has committed to the World Health Organization's goal of eliminating hepatitis by 2030, here in Manitoba, we're unfortunately going in the wrong direction. Joining us this morning to explain why, and more importantly, what we can do, is Dr. Kaita, Section Head of the Hepatology and Director of the Viral Hepatitis Investigative Unit. What a title, Dr. Kaita. Good morning. Thank you.
Good morning. Good morning. Thank you for having me.
Let's start with the basics. What is hepatitis?
So hepatitis, in particular hepatitis C, it's a virus that infects the liver, and over time, whether that's years or decades, it can cause considerable damage, and the end results can sometimes be life-threatening.
Here in Manitoba, what are we seeing in terms of the numbers?
So, you know, there was surveillance data by Government of Canada in 2021 which showed we were on track. In fact, between 2012 to 2018, there was only a slight increase, and then from 2018 to 2020, there was a dramatic decrease in the number of infected individuals. But for some odd reason, in 2021, we saw an upswing in the number of individuals diagnosed. In 2022 data, it looks like it'll be the same. And it's suspected that that might relate to the opioid epidemic and the methamphetamine epidemic that a lot of the provinces are seeing right now.
What are some other factors and some groups that are most highly impacted as well?
So obviously those who participate in recreational drug use, everyone's quite familiar with, but even if you adventure out and you do unprofessional tattoos, body piercing, that's a significant risk factor. Blood transfusions prior to 1990. But I think what is most important is for people to understand that if you're in the age group born between 1945 and 1975, you're 5 times more likely to have been exposed to the hepatitis C virus. So we advocate everyone born between those years to get out and get tested. One single blood test.
What does that look like? How often should people be doing this? I know that's a huge risk factor for that age demo.
Sure.
But should everybody be doing this?
Yeah, absolutely. If you're born between 1945 and 1975, go see your primary care provider, ask for a hepatitis C test. Get tested. Because unless you know you've been tested and you've been diagnosed with or without it, you'll never know. It's a silent disease. Most often people have no symptoms right up until the time when the liver starts to fail.
We have less than a minute left, and so I wanted to say, tell us about the research, but I know that we're not going to get to it to be that concise. From an information standpoint, from an educational standpoint, what do you want people to know?
It's a curable disease. Get tested, get cured, and then we can reach that 2030 goal, hopefully, of eliminating or eradicating hepatitis C globally. Is there any resources or any website that you want to send people to? So I think the Canadian Liver Foundation is an excellent resource to start with. And then beyond that, there are several other resources that you can, even the Viral Hepatitis Investigative Unit has a website that you can take a peek at.
Thank you so much for this conversation.
Thank you for having me.